It's pretty wild to think that a simple two-digit number can literally make or break a medical claim. Today, we're going to pull back the curtain on a tiny detail in medical billing that has a huge impact: the codes that tell your insurance company where you got your healthcare. They might seem small, but oh boy, they are the difference between a paid claim and a denial.
Ugh, that phrase, your medical claim was denied. It can send a shiver down anyone's spine, right? You did everything right. You got the care you needed, you've got insurance, and then you open the mail and see those four dreaded words. It is so confusing, so frustrating, and it happens all the time. And when you try to figure out why it was denied, you just get hit with this wall of jargon. I mean, look at a cheat sheet like this one. You'll see things like untimely filing, coverage terminated, and dozens of other reasons that just feel totally out of your control. It's an incredibly complicated system.
But what if I told you that, buried in all of that complexity, the real root of the problem was just a simple clerical error, a tiny typo that sent your entire claim completely off the rails? Well, that is exactly what we are digging into today.
And this brings us to the hero of our story, the Place of Service Code, or POS code for short. It's just a two-digit number, and its only job is to tell the insurance payer the specific setting where you received your care. Was it a doctor's office, an ER, or maybe a telehealth call from your living room? That little code tells all.
Now you might be asking, why does this matter so much? Well, it's because insurance companies don't just pay for services in a vacuum. Under one model, fee-for-service, they pay for every single little thing. But under another, called capitation, a provider just gets a fixed amount per patient. The POS code is absolutely critical because it tells the payer which payment rules and, more importantly, which rates to apply. A service in a big hospital is reimbursed at a totally different rate than the exact same service in a small clinic.
So, let's start with the places you probably think of first: the actual medical facilities.
Okay, what's really fascinating here is the level of precision. A routine checkup, that happens at an office, which is POS code 11. But let's say you sprain your ankle after hours and need care right away. That's an urgent care facility, code 20. And a minor same-day procedure could happen at an ambulatory surgical center, code 24. See? 3 different locations, 3 different codes, and you can bet there are 3 very different sets of billing rules and payment amounts.
And it gets even more specific once you're inside the hospital's walls. If you're formally admitted to stay, that's inpatient, code 21. But if you're just there for a quick lab test without being admitted, that's considered on-campus outpatient, code 22. And of course, the emergency room, code 23, has its own special designation. Getting these right isn't just about being neat and tidy, it is absolutely vital for getting paid correctly.
But the system is also changing because healthcare isn't just happening in clinics anymore. This next set of codes really shows how we're receiving care in modern ways, including right from our own homes.
This slide just perfectly illustrates the incredible level of detail we're talking about. Telehealth isn't just one code. No way. If you, the patient, are at your job connecting to a specialist remotely, that's code 02. But if you're on your couch talking to your doctor, that's code 10. The patient's physical location is the key, and it directly changes how the claim is processed. And the same logic applies to in-person home care. If a nurse visits you in your private house, that's code 12, home. But if that exact same nurse visits you in an assisted living facility, that's a different code, code 13. Again, the specific setting dictates the code, which dictates the payment rules. Okay, finally, let's look at a third category. These are the specialized facilities designed for really specific and often intensive types of care. These codes make sure the billing reflects the unique and often higher level of service provided in these places. Now, here's another super important distinction. A skilled nursing facility, or a SNF, is POS code 31. Think of this as a place for short-term, intense rehab after a hospital stay. A nursing facility, code 32, is typically for longer-term care. They sound almost the same, but to an insurance company, their billing codes and reimbursement rates are very, very different. And the same idea applies to mental and behavioral health. There are totally separate codes for being an inpatient in a psychiatric facility versus getting outpatient help at a community mental health center versus living at a residential substance abuse facility. Each code represents a unique environment with its own set of rules.
All right, so we've seen a ton of codes. Now let's bring it all home and connect it back to our original problem, that dreaded claim denial. How can 2 little digits cause so much trouble?
This note from a denial management guide gives us the perfect clue. It basically says that for POS 23, the emergency room, you often don't need a pre-authorization number.
And that makes sense, right? You can't exactly schedule a medical emergency. But other services do require one, and this is where the whole system can just break down.
So let's just walk through a scenario. A patient goes to the ER, that's POS 23. But let's say the billing department makes a typo and codes it as a regular office visit, POS 11. What do you think happens? Well, the insurance company's computer system sees a claim for an office visit, it looks for a pre-authorization number, doesn't find one, and boom, the claim is automatically denied.
So to put it simply, the denial had nothing to do with whether the service was covered or if the patient was eligible. The denial happened because the wrong POS code triggered the wrong set of rules in the payer's automated system. A simple 2-digit error led to a complete rejection of the whole claim.
So what's the bottom line here? What should you take away from all this? Just remember that POS codes literally define the where of healthcare, and they are a massive factor in how providers get paid. A tiny mistake with these codes can cause a really frustrating and expensive denial. So whether you're a patient trying to make sense of your bill or a provider trying to get it right, understanding these categories is absolutely the first step.
It really makes you think, doesn't it? These two little digits are just one piece of a massive, intricate puzzle. And it leaves us with a much bigger question. In a system this complex, what other seemingly small details are out there, quietly shaping our entire healthcare experience?